Good afternoon. Welcome to our CASO webinar on procurement during the pandemic. My name is Giovanni da Silveira. I'm Professor of Operations and Supply Chain Management at the Haskins School of Business and Director of the Canadian Centre for Advanced Supply Chain Management and Logistics, CASO, at the Haskins School of Business. Our center aims to develop and disseminate world-class knowledge on supply chain management and logistics through education, research, and community engagement events like this one. I would like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to the Metis Nation region of Alberta, Region 3. We have many guests today, including people from the corporate community, our students, and colleagues from the Haskins School of Business. I'm honored to introduce our presenters for today. Jane Zhang, she's a co-founder and chief operating officer, and Lori Tetzlaff, senior strategic sourcing specialist at ETCH Sourcing. The webinar should take about 60 minutes, which includes presentations and Q&A. Questions can be posted at any time in the Q&A box and will be answered as possible. If a question that you are interested in has already been posted, so you can upvote it by clicking on the thumbs up button in the box. So without further ado, let us hear from James Zhang and Lori Tetzlaff. Thank you very much.
Wonderful. Well, hi, everyone, and thank you so very much for joining us here today. And a big thank you to you, Giovanni, and the CASO team for having us here today to share a story. So this is really a very near and dear story to our hearts when it comes to procurement and leveraging the power and experience of procurement in addressing COVID-19 challenges. We really want today to be useful to everyone that's attending, so we do encourage you to send questions via the Q&A. We'll take a mid-presentation break as well for questions, so please don't feel like you need to hold your questions to the end and send them in early. So our story in getting involved with securing PPE for frontline workers really began back in March. I'm sure all of us remember the very, very surreal moment when that first lockdown order came, and even though we knew it was coming, it made it all very real. And many organizations just were not ready for this unprecedented scale of a pandemic that we're currently living through. Our team was actually one of the very fortunate teams that experienced almost zero disruption. We were always set up for remote services, and we were able to transition immediately to continue to support our clients in the same way we always did. But it didn't really change the fact that the world around us had actually changed significantly. And looking around us, we saw there was a shortage of safe and certified PPE. People were really scrambling to secure any sort of PPE, really, at all kinds of ridiculous markups, delivery, quality metrics. There was almost a black market at one point formed with people reselling medical supplies, buying from untested sources like Amazon, Alibaba, eBay, zero guarantees that this PPE would satisfy the need. And while this shortage actually applied across all of the population, there was a very particular group of people who were heavily impacted, and that was our frontline workers. So those individuals serving in high-risk centers within places like the drop-in centers, the support facilities, the long-term care facilities, without a source of reliable PPE, these individuals worked in an environment of increased risk. Just by showing up to work, they were risking their health every single day. So we really asked ourselves, what could we do? How can we help? And after all, this was really a procurement problem. And at Etch, we specialize in solving procurement challenges. My co-founder and I started our company over 4 years ago with just one goal: creating lasting value for clients by leveraging the power of procurement. And through the years, we've honed our expertise and our competence in this area by providing managed procurement services, sustainable procurement, and digital procurement expertise to organizations all across Canada, the US, and globally. We've worked with clients across all industries, from finance, oil and gas, healthcare, to agriculture, and we know the power and results that procurement can bring to the table by applying a structured approach that focuses on creating innovative solutions. But none of what we're actually here to share today would have actually been possible without the amazing passion and heart that the team, our etchers, actually have. So when we posed the opportunity to step up to our team, we received an unanimous agreement from our etchers. We knew procurement expertise was needed to solve the challenge here of PPE, and we were really ready to jump in with both feet. So the challenge here was really, how do we secure a regular supply of high quality, guaranteed PPE for the amazing organizations that we collaborated with to distribute to the frontline workers? And the team that worked on this truly went above and beyond in a time when the supply chain landscape was disrupted like we've never seen it ever disrupted before. And so with that, I'd really like to invite Lori to share the journey that we took with our partners to address these challenges. As lead on this project, Lori did an incredible job securing the supply needed in a short time frame and helping to gear up our frontline workers during a very, very difficult time. Lori, with that, I'll pass it over to you.
All right, thank you, Jane. All right. So I just want to provide a little bit more background of how we actually got involved in this initiative. So as Jane mentioned at the start of the crisis, we're aware of a lot of organizations going through significant challenges. Even the largest, most refined supply chains in the world were under an extreme amount of supply chain stress. So knowing our position in sourcing and in a consulting role, we knew we wanted to leverage our expertise and our resources to find local organizations and try to help in the way that we could to help them not struggle. So offering through pro bono consulting. So at that point in time, there's tons of awareness about the shortages of PPE. So we did want to reach out to organizations specifically that we assumed were dependent on PPE, but may not have that in-house procurement expertise or may not have the budgets because this wasn't planned by any of these organizations. So at that point in time, from reaching out to the community, we were able to connect multiple smaller organizations that were supporting frontline workers of vulnerable populations in the local community. These organizations had aligned objectives and they're experiencing similar challenges. And when I say vulnerable populations, I mean shelters for people experiencing homelessness or other social and economic vulnerabilities, as well as long-term care facilities and medical clinics. So upon reaching out and starting to connect these organizations, what we learned at that time, so PPE is traditionally provided from the Alberta government to healthcare organizations, but with the additional protection measures being put in place in hospitals and then private organizations themselves that typically don't rely on PPE, there was a massive demand for it. So this contributed to the huge demand and limited supply, and gaps started to be present for those frontline workers as well. So, and the organizations that we are working with, they're smaller nonprofits. So typically when PPE is provided, it's provided directly from the government. So they didn't have resources, they don't have people in-house who are able to procure this for them. As well, they're competing with larger companies. So companies that maybe already had established relationships with suppliers and larger volumes, providing to hospitals where they can make those large upfront commitments and large 100% down payments of PPE as well. So given our existing supply chain resources, we aren't traditionally sourcing PPE. We do have access to an extensive list of suppliers. We have an established sourcing process, so we're able to leverage this and start to identify opportunities for the organizations. And then, so I want to cover next the actual organizations that we worked with directly. So provide a little bit of background on them and the challenges that they were facing at that time. So there's two primary groups. So Helping Alberta. So first, they're an entirely volunteer-based organization. They were founded during the pandemic for the purpose of actually addressing that gap in PPE for frontline workers and vulnerable populations. And honestly, they're really a great example of how the community came together to keep each other safe and healthy. The majority of the volunteers are from the medical community, but they also had a lot of outreach. So not just ourselves in offering supply chain expertise, they had legal advice for becoming a nonprofit. A local manufacturing company offered up their warehouse so they could store stock there. They had IT help for managing their inventory. They had people managing PPE drives. They built a GoFundMe. So they had a lot of support, and it's a really great story. So at the beginning of the, so they actually received a significant amount of PPE and a significant amount of funds, but they needed to build those relationships. So they were a new organization. They needed to build these relationships with both suppliers, but also the actual entities that would receive the PPE. So, or actually the original orders that they placed were, for example, as Jane said, through Alibaba. So supply was so limited. It was one of the only options that they had. So they were going online. The actual lead time route was completely variable. So oddly shipping back and forth, really variable lead times, high marked up rates, And fortunately, the quality they received was sufficient for what they needed, but they didn't have that certainty going into it. As well, the PPE donations started to dwindle over the months of the pandemic. So they did have the GoFundMe available, but they really, really needed to maximize the dollars spent in that to get as much PPE as possible. Another interesting challenge with that GoFundMe, because it can take quite a bit of time to become a nonprofit, the volunteers would actually be personally liable for the withdrawals from that GoFundMe until they're a nonprofit, and they couldn't offer tax receipts as well for the donors. So they had some challenges there. The other organization that I'd like to highlight is Street Cred. So they're an existing organization. They're a part of the O'Brien Institute for Public Health, a part of the university's Cummings School of Medicine, and specifically in place for driving initiatives to benefit the vulnerable. So they already had these relationships in place with different organizations that are supporting those vulnerable populations, but they're not typically a PPE provider. So when they started speaking with these different entities, they found that while the government was going to provide PPE, exactly what and when, there wasn't a lot of visibility. So there was a lot of uncertainty experienced by the organizations to be able to keep those populations and the frontline staff safe. So Street Cred pivoted and started to provide PPE through donations and grants that they had, as well as training. So identifying best practices and training those actual organizations on how to consistently and effectively use PPE to, one, sustain the actual use of it, and then make sure everyone's using it in a safe way. One of the minor challenges they had, so they were able to secure funding, but they did require firm quotes and a breakdown to be able to actually finalize that receipt of the donor funds. And then again, as this isn't an area that they typically provided, they didn't have in-house procurement professionals, they don't have existing relationships with suppliers of PPE, and they didn't have a formal warehouse facility. All right. So from there, while there's many different aspects of sourcing, for this process, we found that there were 3 big core procurement competencies that played the largest part in achieving the needs of these organizations and driving the improvement in sourcing PPE for them. So first, market research. So we have the processes, tools, and the database to be able to unlock and leverage the data available to actually establish a qualified and cost-effective supply base. Economies of scale. So by bringing these organizations together, which then we're supporting an aggregate amount of other shelters around the city, medical clinics, etc., that we are able to increase the volumes required and actually increase our leverage in the marketplace and establish them as a stronger customer. And then finally, relationships, which we think is so important for positive relationships and collaboration with suppliers within sourcing. So we are also able to leverage this procurement process to establish a strong collaborative relationship with suppliers so these organizations have a reoccurring and trusted supplier base. So we're going to do a quick pause of questions here in case there's any initial questions before we continue on with the actual supply chain process followed and the results that we achieved.
So, Jane or Laurie, I believe that one important issue here is talk about building relationships with suppliers. It's something that is often mentioned by experts in supply chain management. I guess in practice, is easier said than doing. So, can you explain to us? I mean, what factors, what enabled the building that relationship? What kind of suppliers will be better allies in terms like that? And would facilitate the building of those relationships. What factors must be in place for this to be successful?
Absolutely. So I think one of the biggest key things is really open communication about your priorities, open communications with your suppliers. Now, there is a school of thought in negotiations and in supply chain where, people believe you should hide and hold all your cards and play them strategically. At Etch, we really believe that, in order to establish a strong, lasting value with your clients, you need to establish strong supplier relationships, because ultimately speaking, at the end of the day, when the engagement is said and done, when the contract is signed and everything is finalized, that supplier is accountable and responsible for delivering on the product itself. That supplier must provide the service, and they must provide it of quality and meet your clients' needs. So we really see our role within procurement as a support function to establishing open and collaborative relationships with suppliers who really share your business objectives. So knowing and understanding where your suppliers are coming from, what their needs are, and also having that open communication around your priorities will help you identify the right supplier for the need that you're looking for. So that is a very big critical part of what we believe in when we approach any sort of engagement with procurement.
Okay, can I ask another question that caught my attention? We try to engage our students and promote the idea of social entrepreneurship. It's very important, of course, that our students, our people here in Alberta develop successful career in supply chain management. But I think as this year has demonstrated, there is also an opportunity to do something that you guys have been doing over this initiative, which is to provide some wider benefits to society. So I wonder, how did you get together? What happened behind the curtains? I mean, how did Edge and Helping Alberta and Street Cred started working together, and where this idea of providing PPEs come? So a little bit of the history and the background of this association between those three partners. How did it come off back in March, I guess? How did it happen, please?
Absolutely. So why don't I start, and then Laura, you can add on a little bit more there. So we actually went to market. So Etch sourcing as a whole, we went to the market back in March, and that was the conversation. We had a very open conversation with our team, and we said, look, there's a supply chain challenge out there. There's no question right now that there's a supply chain challenge out there. All you have to do is go outside, look around, see how, there's no masks, there's no PPE being supplied anywhere. And we know it's a supply chain challenge. We know it's a procurement challenge, and we know that's something that we can help with. So how, are we willing as an organization to step up? And like I said at the very beginning, I have an amazing team. I'm very fortunate to work with some fantastic people, and everyone just said, absolutely, we're in 110%. So we actually put out to the market back in March, pro bono COVID-19 support services. And that is something that we opened up specifically, and we still have open right now for organizations that are really looking for just, I need to talk to somebody about ideas. I need to talk to somebody about my challenges. And I know I have a procurement challenge, but I don't have the procurement expertise. I don't know how we can get connected, but I don't know what my next steps are, but I know I need procurement expertise help, and I need procurement expertise support. So that's what we really wanted to do. We wanted to create a forum where any organization that's really struggling right now because of the effects of COVID could actually come and engage with us. And from there, that's actually how we got connected with the drop-in center. So Laura, maybe I'll let you tell that story.
Sure. Yeah. So at that time, we each kind of individually started to reach out to our different contacts in the community and kind of directly gauge if they needed support. So when we reached out to the drop-in center, at that time, they were working with AHS, so they actually didn't need the actual sourcing support at that time. But given that they were working with other associations like Helping Alberta and Street Cred, we were able to get those names and contacts. We were able to start bringing the meetings together, and then bringing those two entities together. So doing some initial scoping with both of them, making sure the needs and objectives were aligned with what we were trying to accomplish. And then, we were able to get them together and then start to build and grow from there.
And it's a very interesting parallel to how you perform your job as a procurement function within a large organization. A lot of the times within large organizations, there's one supplier who's selling to multiple business units, and those business units may not talk to each other. So you're not actually getting that consolidated capability to leverage and to understand and to communicate. And part of your role as procurement is to understand how organizations spend their money, which suppliers they spend it with, and what are the business units' requirements that specifically tie back to how an organization spends. And so it's a very interesting parallel for how we took basically the procurement principles that we were using within our client organizations, and we applied that externally within multiple organizations.
Okay, thank you. I don't think we have any more questions for now, so thank you for now.
Oh, wonderful. Well, Lori, back to you.
Perfect. All right, so first I want to walk you through the process that we followed for sourcing the PPE, and then I'll go into the specific results achieved throughout it. So first off, Etch has an established 6-step process that we would apply for any client engagement. So previously we weren't sourcing PPE, but it's the same process that we would apply anywhere, and we ended up applying here. And I think that's one of the great parts of actually being in supply chain. So you'll likely support across many different industries in your career. And of course, each industry is going to have their nuances and their unique requirements and kind of learning curves. But generally, the same processes and tools can be leveraged no matter what you're purchasing and in whatever industry. So throughout our process, we start with category management, which essentially just involves the assessment and identification of the opportunity. From there, we flow into the actual strategic sourcing, build out and execute on our strategy through the direct supplier negotiations and the contract. And from there, we manage the supplier performance and the relationship. So specific to this engagement, how we started the process, we met with each of the organizations to first understand specifically what products they needed. So each of these organizations, Helping Alberta and Street Cred, were helping other multiple organizations and local ones around the city. So we needed to confirm what they needed and what level of certification that they needed for it. So in this specific initiative, we were mainly focusing on level 1 masks and then reusable and disposable gowns. So while they did need hand sanitizer and gloves, a lot of local breweries stepped up to help with the hand sanitizer and the gloves. For these specific organizations, they didn't have that exact gap in supply. So we focused on the gowns and the masks. So from there, once we understood their needs, what products they required, we needed to understand their short-term and long-term needs, as well as the budget constraints. So from there, we started our market research. So we understood what types of PPE are actually out there, what the certifications are, what's actually required of suppliers to legally be able to provide medical goods within Canada. And then we generated an extensive list of PPE providers and initiated contact to all of them. So confirming what supply they actually had available, what were the costs, what was the lead time, what was the actual source of manufacturing, and what certifications could they actually provide and guarantee for us. So from there, once we understood what was needed, what was available, and the actual constraints and the requirements for ordering, we were able to start to prepare the actual opportunity and strategy. So there was a large amount of suppliers, but one of the biggest challenges was even getting a hold of them at this time period. So we didn't have those existing relationships. So we were reaching out by call and email daily. And there's so many large providers in this space, just getting a hold of them was very difficult. But once we did actually get a hold of quite a few and we were able to have secure contacts with, we started to confirm the availability and the rates. And those were changing almost daily at times. As well, manufacturers often, they were waiting to hear when they would get their supplies. Another key challenge too was that a lot of the suppliers we typically go to would be based out of the US. And at that time, they were both unable and at times unwilling to actually ship to Canada because they were equally constrained. So this was a global issue trying to source PPE. There was also significant lead times on items being brought in internationally because everything needed to be inspected and it was holding up actual air freight. So a lot of planes, even if you made a purchase, planes were being fully loaded because they needed to leave, but the inspections were taking too long. So even when you made that commitment, sometimes your supply wouldn't even arrive. So actually, while air freight is typically faster and more reliable, it was actually completely variable in this specific scenario. Another internal challenge as well is that we, in the aggregate kind of amount of the volumes, we were still a very small player. So we didn't have a large long-term demands as well because the government would typically be providing this directly. So we weren't certain exactly when the internal supply would catch up as well. So we couldn't commit to that long-term forecast with the suppliers. As well, we didn't want to do large upfront 100% payments because these are entirely donated funds and we wanted to mitigate that risk to the organizations. So from there, we actually refined to a Canadian supplier. So they were originally an apparel manufacturer and they were one of the ones that in the call for companies to kind of pivot and provide these critical goods, they pivoted their manufacturing for masks and gowns. So they were actually, so how we selected them in the end was they were actually able to provide all the products that we needed for each of the different organizations. And then they also had lower or at least average cost in comparable to the other suppliers. They were utilizing ocean freight, which reduced the costs as well as actually mitigated the uncertainty in the lead time in this scenario. They were actually able to provide inspection and certification details. As well, they were more of a mid-sized organization, so our volumes actually aligned with their abilities too. So we were able to meet those order quantities. And then the fact that they were Canadian, so it was a mixture of both domestically made and internationally purchased goods. So that was also a consideration in our selection as well. So when starting out the supplier negotiations in the contract, we really weren't negotiating from a position of strength over these suppliers. We were still quite small. But we were able to leverage what we had, which I will go into further soon. But we were able to receive discounted rates and we were able to get committed lead times and negotiate the delivery terms that were able to meet the needs of the organization. Following finalizing the order or during the process of finalizing, we're actually able to leverage the strengths across the organizations too. So Helping Alberta wasn't a nonprofit yet and they were smaller, whereas Street Cred was an established organization. So they were able to make the payments on behalf of both the organizations to simplify and consolidate the payments and mitigate that risk for the volunteers for helping Alberta. And then they were able to reconcile the payments between themselves after the fact. And then we were also able to leverage Helping Alberta's warehouse. So Street Cred didn't have storage facilities available to them, but through Helping Alberta's volunteers, they did have access to that. So we were able to ship to one location with the proper receiving and storage facilities, and then volunteers could collect and deliver through there. So, and we were also able to ensure that the shipping dimensions were actually able to received and hand moved by the volunteers too, to make sure that when this arrived, people could actually handle it and bring it out to these smaller entities as well. From there, we move into our supplier performance and relationship management. So once we had finalized that order and the terms, we made sure to frequently and openly communicate with the supplier throughout the process. So we followed up on the manufacturing and the delivery dates. We ensured that the delivery information is correct. You know, there's one, it's billing to one organization, it's shipping to another in a borrowed warehouse. So we needed to make sure everything was completely aligned, make sure that these don't go missing on the way. We followed up for pictures before shipping and the actual inspection certificates to know those goods were actually qualified, and then coordinating with the warehouse personnel the actual day of to receive it and make sure it was placed the way it needed to. And then as well as just following up after the fact and ensuring quality and actual delivery acceptance to make sure that the supplier actually met the needs that they committed to originally. So I'd like to shift to highlighting the key sourcing results. So, and I want to tie this back to those 3 core procurement competencies as well. So market research, economies of scale, and relationships. So first, for market research, when we started this process, we gathered a list of approximately 130 suppliers of PPE. So we contacted all of them daily, and we are actually only able to refine that list to around 9 suitable suppliers that were actually able to supply in Canada, had the stock for the products that we required, and actually had generally favorable terms for purchase. So from there, we further refined that list to just the one supplier that met all of our needs with the consolidated order with the quality certificates. Through market research as well, we're also able to verify ahead of time what certification levels there were for the PPE. Again, we weren't originally sourcing PPE, so this was a learning area for us. So we needed to ensure that we were completely aware of all the requirements in this industry. So then we were able to know the certificate as well as the license to ensure that the supplier was actually legally able to import and manufacture and sell the medical equipment across the country. Through research, we were actually able to keep costs down on the shipping too. So first, by relying on ocean freight instead, so knowing that there was that uncertainty in air freight, we knew that we were more comfortable actually proceeding with the ocean freight as well as the reduced rates for it. But we were actually able to gain confidence in the packaging that the products were provided in too. So from what we learned at that time, a lot of companies were receiving it in poly bags and then repackaging it into boxes, which actually adds time and money to it. But the poly bags were actually more than sufficient and competent to actually just directly ship in that. So through research and validating that, we're also able to keep the time and lead time down. So that leads into economies of scale. So we weren't a large customer, but we were able to leverage what we had. So the end users were nonprofits supporting frontline workers during a pandemic for vulnerable populations. So just the actual the groups that they're supporting, we're able to leverage that, as well as actually the PR based on these end users. So given the pandemic, they had a very active social media presence across these organizations. So we were able to leverage that PR opportunity to be able to get discounts on these purchases. We're also able to aggregate the needs across a large group of organizations. So based on all the needs across the organizations, we're actually able to align with the order quantities for the PPE that we needed. So from there, that means we are also able to maximize the donated funds by optimizing those order quantities to the exact needs of the organizations. And then as well, we were able to mitigate risk and reduce the costs by leveraging each other's infrastructure as mentioned. So the payment conducted by Street Cred and the warehouse provided by Helping Alberta. And then that leads us into relationships. So throughout this process with the supplier, we were actually able to establish a reoccurring and trusted relationship with the supplier. We were able to mitigate the risk to the organizations by negotiating that the supplier be accountable for the shipping directly to the warehouse, as well as being responsible that if the goods were damaged in transit or once received and inspected, if they weren't of sufficient quality, the supplier was accountable to replace those goods. So that was mitigating the risk for these organizations. Again, they have limited donated funds. They're on a deadline already. They're experiencing shortages. So making sure that the supplier was actually being accountable for the quality and delivery. And then through open and frequent communication with supplier, we're actually able to safeguard the delivery timelines of the goods. And then as part of ensuring supplier performance, there were some minor discrepancies in the actual final invoicing, but as part of sourcing, you always want to go back to those invoices, double check against what the terms you committed to. And because we have that collaborative, good working relationship, we are able to reconcile and actually update and correct those variances so the organizations were paying for exactly what we agreed to. Right, so just shifting to the key organizational results achieved for those organizations. So first, they were able to receive high quality certified PPE. They were able to share that warehousing facility to streamline receiving and distribution process while keeping those costs down, as well as shipping costs down because they were consolidating to just one location. They now have a secured, reliable supplier for future purchases. And they were able to actually mitigate the risk for volunteers by consolidating that payment as well. So this chart on the right, it's just a breakdown of the count of units of PPE and the types of facilities that they were distributed to. So we mainly focused on masks and gowns. So that's all included in the count here. But we were actually able to support over 30 end user organizations that were actually able to benefit from this specific initiative. And it's a range of shelters. So for people experiencing homelessness, as well as specific for families and women, Indigenous groups, collaborative support facilities, long-term care facilities, and medical centers. So it was a really, really great initiative, and we were able to help a lot of people directly in the community. All right. So sustainable procurement is a core offering at Etch. And I'd really like to conclude the presentation with some thoughts on sustainability and PPE, and as well as what you and your organization can do to make more sustainable choices. So at Etch, we truly, truly believe that change can be driven through the decisions made at the time of sourcing, through collaborating with your suppliers, and it doesn't have to be a labor and cost-intensive process. So specific to PPE, one of the items that we sourced was these reusable gowns. And while some of the facilities are limited to being able to use this, if they don't have laundering facilities, then they're limited to being able to use the reusable gowns. But when they are able to, the cost of the reusable ones are not even double the cost of the disposable. So even past once use, the value for the organizations, which are especially constrained financially, helped immensely. So making a sustainable choice, but actually mitigating costs for the organizations themselves. Another way to be sustainable is actually by sourcing more locally with Canadian manufacturers. So from the pandemic, both the federal and provincial government both put out different calls for companies to help pivot and provide these core critical supplies within Canada. So it's not only an economic driver for our economy, but it also ensures local availability of these critical goods and services going forward. So one example is the apparel company that we sourced the masks and gowns from. But even since that time, there's more companies that AHS has started to work with a local manufacturing company, Orpix, for manufacturing masks as well. So a point to remember is if you're going for PPE, try to buy from Canadian suppliers when you can, and don't just accept the first available opportunity either. So we weren't negotiating from a position of strength. We weren't a huge customer base, but we were able to still leverage what we had, receive the goods that we needed, and support a local business at the same time. And then just yourself as a consumer, and especially leading up to Christmas, we're going to be doing a lot of shopping and online shopping. So try to buy local when you can, but if you can't, try to buy early to actually mitigate that extreme stress on the logistics providers as well. So buy early so that they can level out that demand leading up to the holidays too. And just on a final note, Helping Alberta has scaled back their volunteer efforts, but they are still connecting donors to the different vulnerable populations. So if you are aware of available PPE to donate, you can connect with them through their website, helpingalberta.com. Thank you.
Thank you, Laurie. Thank you, Jane. We have lots of questions here, so quite interesting questions also. So let's try to go over all of them. So one anonymous attendee asks, what are some of the governance processes or expertise that you had to put in place to reduce fraud risk during this time?
Absolutely. So I think that's a very great question. And I think it goes back to what we shared earlier on, what Laurie went through, really the full procurement process. That was the governance that we used. We haven't done anything different here. We haven't done anything specifically unique when it comes to, because it's PPE. It's the same process that we put in place hundreds and hundreds of times before with clients when it comes to sourcing something that they don't previously have. So whether or not we're buying a new software system, whether or not you're sourcing new technical professional services, whether or not you're sourcing maintenance for your buildings, for your operations, anything like that, it's the exact same process to go through the 6 steps that Lori took you through. And in that assessment phase, in that opportunity identification phase, in that supplier negotiation and supplier contact phase, that's when we're applying all of the supply chain principles to make sure that we are actually actively assessing each supplier for their financial health, their stability, their reputation, the years that they've been in business, all of those factors we're taking into consideration. So that's how Lori and the entire team that worked on this project were able to take that funnel from 130 suppliers all over the world, different varying levels of experience all over geographically, and really filter that down to 9 qualified suppliers, and then drive that through the sourcing process that was applied to that one very solid, qualified, safe, and assured supplier, because it was really, really critical that for these organizations and the hard-earned, the hard-gathered money and the donation funds that have been provided from the community as a whole, that these funds really get leveraged to be maximized to create impact in the area that they were intended for.
And I can expand on that slightly too. So specific, we also validated that the supplier themselves had their MDEL license. So that's the medical device equipment license. So the government had already provided that license by verifying that they have the processes in place, the quality inspections, et cetera. So they're already validated for both the manufacture, importing, and distribution of these goods. So we validated that they did have that proper license. As well, we mitigated the payment terms. A lot of suppliers wanted 100% upfront payment, and we didn't want to go with those suppliers because these are donated funds, and we wanted to mitigate that risk because there's still always going to be some uncertainty the first time you go with a supplier. So we staggered that. So there was one upfront payment for the deposit, which actually locked in those rates, and as well as on shipping and then upon receipt. So staggering those delivery terms to kind of protect the organizations and maximize those funds that they did have available to them.
Thank you. So a question from Maru. What are the terms for guaranteeing supplier responsibility up to the point of delivery?
Sorry, can you say that one again?
Yeah, if the supplier was somewhat responsible for the delivery of the goods up to the point when you receive that, if there is any guarantees that they would assume responsibility should, for example, the goods not be delivered on time or not exactly the specifications you are expecting. So are there any guarantees or maybe? Yeah.
So we had negotiated with them. So including in the price that we paid was actually the insurance and the shipping cost. So they had guaranteed in writing. We wanted to make sure we had everything in writing, kind of contractually controlled, that they were guaranteeing that if we received it and the quality wasn't what they committed to, so that level 1 certification, then they would be responsible for replacing it, as well if it was damaged in transit, then they were also responsible for replacing it.
Okay, thank you. So another question from another anonymous attendee. What are some of the governance processes or expertise that you had to put in place to reduce? I think you kind of addressed this question already.
I think we answered this one. This was the first question asked, Giovanni.
Just someone upvoted, so I apologize. So this one's gone. And it's still providing pro bono, and how can we connect with Etch if we need support in our supply chain for PPEs?
Well, you can always find us. Our website is there, and you can contact us through the contact us form. And honestly, like, part of the reason why we started to provide this service as far as a pro bono basis is not that we specialize in procuring PPE. We don't specialize in producing PPE. What we specialize in is helping people address their procurement challenges and address the procurement challenges that do come out of this. So we're always happy to have a conversation with somebody who wants to reach out. If you're having challenges, please do. I encourage you to send a note through us through the contact form on the website, or you have Lori and I's email in the presentation itself. We're always happy to chat and see what we can do to help your organization.
Okay, so we have a question from Pavel. What are the most prominent issues you encounter when contacting prospective suppliers, and how do you overcome those issues?
So one of the main issues was honestly getting a hold of them. So because we didn't have those existing relationships, we were more so reaching out to the more general emails and numbers. And to start, it was just persistence and volume. So there was a list of 130, continually following up with them. When they did get back to us, immediately following up with them, requesting quotes, having really concise requests out to them. So saying exactly what we were looking for to kind of stream that communication and, being able to align right off the bat, if they were actually a supplier that could meet our needs and if we were able to meet their requirements as well. Because again, we had lower volumes. So for some of these suppliers, the minimum orders, we wouldn't even be able to meet their terms, or we didn't want to pay 100% upfront. And then suppliers in general, a lot of the ones you would typically go to, a lot of the traditional suppliers of PPE are based out of the US. So that was another challenge because they weren't shipping to Canada at that time. And that was the case for a lot of international companies, actually. So being able to get it actually in Canada was one of the larger challenges. So being able to find a company that already had a mix of domestic manufacturing, but as well already had those licenses and relationships in place internationally to be able to legally import and then distribute PPE was one of the other areas that we needed to receive those certificates as well to show that they were able to do that.
Okay. So I have another question from anonymous attendee. What is the general timeline from the needs identification or requisition to the contract formation and the receiving goods? Usual timeline involved in all this process.
Trying to remember now, it's so long ago. So I'd say that the needs assessment probably took about 2 to 3 weeks. So we were connecting multiple organizations. There was a wider net than the original blend of just Street Credit and Helping Alberta. There was a few different associations that were interested. So, almost daily we were kind of doing a mix of, okay, what's the counts? The supplier contacting process, it was probably about a week of, hard driving, contacting them, actually narrowing it down. The actual delivery terms, they'd committed to 4 to 6 weeks. We ended up receiving in about 4 weeks. With the exception of the reusable gowns, because interestingly, it was the first time they were imported into Canada, so they needed to go through additional inspections, but the supplier was upfront about the increased lead time on those items. So I would say in total, it probably was about a 2-month process, but now that the supply base is set up, the order and the actual suppliers have a lot more supply, kind of those gaps have started to reduce. So now that we have that in place, we've validated, we know who's available. It's definitely a much quicker process for reordering now.
Excellent. So a question from our colleague, Peter Wallace. For sustainability and green products, cost is still paramount, and buying Canada is still more expensive than China, particularly when sourcing micro or biofiber components for cleaning devices. So any thoughts about this difference in cost? Is that something that can be addressed, or is it still a challenge buying from Canada as opposed to, for example, from China?
So I think that's, and I'll start here, Laura, and you can jump in as you wish. I think that's something that we hear a lot of in procurement, and especially when we look at a lot of these consumer goods that are very easily reproduced in China and in places where labor cost is lower, where material cost is lower, and all those elements. The challenge that I think the way that we approach sustainability and sustainable procurement at Etch is we really approach it in an integrated fashion. So not focusing on just here is one unit of a gown and here is the 1 unit price compared to this unit price. We're really looking at it from a total cost of ownership. Like, what is the key priorities that you're trying to address with this need? By sourcing these microfiber gowns, what are you trying to address? Is there an alternative? Is there a local alternative? Is there something that can be taken in terms of your total cost of ownership? If you're buying disposable gowns, what does that actual volume look like over the course of the year compared to what you're going to be looking at if you're using reusable gowns? So all of those factors really come into play when we shape out that opportunity. And that's how we address kind of the sustainability cycle as an integrated function of the procurement process.
Okay. So Donnie asked a question here that honestly I was been thinking myself, and so I think that's a very important question. We are now in the so-called second wave of COVID, and Donnie asking if you found that right now the PPE supply chain bottlenecks have reemerged, and if so, can you perhaps compare the current situation to the situation we faced in winter how we have to adapt to this process now? Is it easier now, more difficult, the same? What are they overlooking right now?
So we haven't made a recent purchase since the second wave, but I have seen the quotes have already went down. So from the rates that we're actually receiving, that early spring timeframe, a lot of those suppliers they do appear to have caught up. So they have stock available now. The costs have went down. They're leveling out. So that's definitely more optimistic in that standpoint as well. As we mentioned, a lot of manufacturing is pivoted within Canada. So there's actual local providers already manufacturing those goods locally. So we don't have those long variable lead times to worry about anymore. So I know they've already pivoted. There is actual domestic supply now. So while I haven't made a purchase recently in the current environment, I would definitely view it to be a lot less variable and certain at this time, and especially kind of that quality mitigated because it's that domestic, and then we're already familiar with the types of quality certifications that would be provided and the types of inspections.
And
Okay.
I'll add to that, with Lori and the team, I mean, really, they did a phenomenal job. It was a very different time. And I know there was during the time of the pandemic in March, the supply chain disruption that happened specifically with PPE and with supplies in PPE, that period of time, you really had all sorts of different disruptions when it comes to shortages, when it comes to certifications, when it comes to quality. You had suppliers in the US refusing to ship across the border. And those were challenges that really come from an unprecedented level of disruption. And now we're in the second wave, absolutely. But we're in the second wave now, having spent a year in this space. And now suppliers have had time, and the industry as a whole has had time to adjust. So even though the demand might increase, it's almost like, as far as the disruption itself to the supply chain base and to the supply chain logistics, that has been mitigated and that has been brought under control. So it's a very different environment now. And part of, the goals of what we wanted to establish with this engagement with Helping Alberta and Street Cred was to give a strong source of an established supplier relationship, so that the next time that the need does arise, if the need does arise, they can just call up the supplier, and it's a very easy, all the certifications, all the checks, all the QA has been done, and it's just a very easy order placement.
That's nice to hear. That's good news, right? So I have a question here from Vivian. I'm not sure that you guys can answer that question, but so how and who to contact in regards to the adequate and safe cleaning of lockers in private fitness and recreation facilities? Do you have any idea?
So no, I don't actually, but you know what? That's an interesting one. That's basically what we do, right? And even going into PPE at this, when we first started this engagement, we didn't know who to contact. We didn't know the right suppliers to contact, but that's the procurement function. We specialize in finding those people for those opportunities. And that's what we do in our functions within organizations, within corporations. And it's just the way I like to describe it is we're experts in the procurement process, and people remain experts in their own fields. We allow the experts to be experts. We allow engineers to be experts in designing the specifications of what they need, and then we help them find and identify the right suppliers to match that need.
Okay, so can I ask a final question? I think that everybody kind of expects that question. So can you summarize what were the lessons learned from, I mean, of course it was an unprecedented crisis. What have you learned from that process to obtain, to restructure or develop all those supply chains, and lessons learned for the future? Should another pandemic or crisis like that happen? Hopefully not, but what can you do better next time? What you learn?
One of the big things is early identification is very critical. And if you think about it, this applies within organizations, it applies within countries, but it also applies within companies. And with COVID-19, we actually had a lot of foresight. We had a lot of notice and warning, not extensive, but we knew that it was happening in China months before it actually hit Canada to the same level and to the same level of impact. And the amount of preparedness that we had going into it, I think there was a lot of thought at the time that, it wasn't nearly going to impact North America quite as strongly. It wasn't going to necessarily impact my organization quite as strongly. My organization wasn't going to be subject to quite as much change and disruption. And I think that early identification is really critical, and that preparedness and that willingness to look at that opportunity and really look at that challenge that's coming and really embrace the reality of that challenge. And as we go into the second wave, I think that's very critical for everyone to keep in mind. It's the changes are a reality. We are living in a society where we're in the middle of a pandemic, and where there is no really going back to the way that it was a year ago. There's really only moving forward in terms of the opportunities and the challenges that you're going to be facing.
And I think, yeah, one of the very critical pieces which has been addressed through companies pivoting is having domestic providers of those critical goods and services that we're dependent on, and then building those relationships and sustaining them. So having those local organizations that we support long-term and making sure that they're available as well.
Okay, just have like two final questions popping up here. So I believe they are brief, so we can go over them. Just maybe a little bit of about Edge in general. So what industry is your primary focus for procurement? Like I said before the PPE or besides that, what kind of sectors do you work with?
So we haven't actually refocused on PPE. Our focus as a firm is 100% procurement. And we've worked across industries. We've worked with oil and gas. We have many clients in oil and gas, in energy, in agriculture. We've worked with telecommunications and aerospace. The way that we structure our services, we provide managed procurement services for all sorts of organizations, depending on what their needs are. So if an organization wants to procure IT hardware and IT software, that is something that we specialize in. If an organization wants professional services and contractor management, that is something we specialize in. What we specialize in is helping organizations manage and drive procurement compliancy and drive procurement business value.
Okay, so final question from anonymous attendee. How do you help, or have you helped the organizations that you, on this initiative, to set up some inventory management or stocking levels for the PPEs? Do you know of any indicators they may be using to track, to keep, to set the stock levels, or to track about purchasing or re-establishment of their stock levels? Anything that they're doing that's a bit more manageable?
So these specific organizations, both of them, they don't traditionally provide PPE. So Helping Alberta specifically was founded for helping address those gaps, but they've actually scaled back their operations now. So they aren't holding the same level of inventory that they were. So we still have the supplier relationship in place. So if orders needed to be placed, we're able to still coordinate based on the same terms that we had. But in terms of actual holding inventory, neither of the organizations are still doing that. As well, it's my understanding, I believe AHS has been able to catch up. So these organizations typically would have those supplies provided directly from the government. So now that that supply base has secured and they're working with those domestic providers as well for these critical goods, from my last understanding is that AHS is providing for these needs at this point in time.
Okay, so let me say that on behalf of the our castle and the Husky School of Business, I'm really thankful for not only your presentation, very informative, but also for the initiative in general. I think that's something that has been inspiring, and even been discussing in class with some students, to be honest. And people are very excited about this kind of initiatives. So I'd like to thank you so much for your work, hard work since March. You have supported so many organizations in need, and also for the informing presentation today. So it was very, very interesting as well. So thank you again. And also thank you the audience for being with us today. And for the many questions posed, I hope that it was something quite informative for you as well and inspiring as we move forward. So thanks for everyone for being here today.
Absolutely. Thank you for having us.
Perfect. Thank you.
Okay, so that's the end of our webinar. Again, thank you for attending, and we will keep you posted about future events held by Castle. So we're starting a new season, of course, after Christmas in 2021. Let's hope that at some point, I mean, we are very pleased to develop those and host these webinars, but also hoping that at some point we may see each other face to face again, going back to our great luncheons that we had downtown. So hopefully that's going to be next year and a better year for everyone. In the meantime, thank you again for attending. I hope everybody stays safe and take care. And if you don't see each other again, have a happy end of 2020. for whatever happened, I mean, I think we're strong, we're surviving, we're doing quite well, and I see you again next year. So thank you, goodbye.